Right. And what are some of the most common misconceptions about being whole food plant-based and bodybuilding that you encounter, and how do you address those misconceptions?
I don't see as many of those as I used to, honestly. When I started bodybuilding in 2011, people were just shocked. They had no idea. Like many people didn't even know what vegan meant, which is fair. I didn't when I first transitioned. But nowadays, it's so mainstream, so commonplace, and enough people have seen films like Game Changers or heard about athletes trying a vegan diet that there are a lot less of those conversations, which is refreshing. I'm glad so many people are more informed than they used to be. Misconceptions are still generally around protein, around eating enough, around carbs as well, especially because the low carb dogma tends to really be persistent. I don't know why. Um, but people are like, how on earth do you not eat carbs if you're on a vegan diet and all you can eat is carbs? It's like, I eat carbs and I do great and I love it. It's wonderful. um, so those tend to be the two things. And my answer for proteins is the same that I just gave you guys a minute ago. It's focus on beans, focus on nuts and seeds, focus on tofu and tempeh. Granted, those aren't pure protein the way a skinless chicken breast is, but they're much higher in protein than most other plant foods. And in terms of carbohydrates, how I address that question is my metabolism sped up when I became plant-based. I noticed I lost body fat and I had to eat more food to maintain my weight than I used to. And that's still the case. It is easy for me to reduce it, yay carbs. It's easy for me to reduce body fat while still eating a good amount of carbs. I'm still lowering my total calories, but in competing with Team Plant Built, which is a team of plant-based bodybuilders and strength athletes, they all pretty much say the same thing, is they are able to maintain a much higher carb intake while they're dieting, even though they're still cutting calories than they used to as omnivores or than our omnivore counterparts can. You go behind stage at a bodybuilding show where everyone's been dieting for 3 or 4 months and they're zombies, whereas the vegans are chipper. We're chatting, we're feeling good. I'm hungry, yeah, I want to go ice cream after the show, but I'm not at death's door, and that's a big difference. So you're eating healthy foods and your body is more responsive to these things.
So one of the things that people have been scared of, I think, somewhat culturally, is the idea that soy is bad for you. It has the phytoestrogens. Do you encounter that? And what are your thoughts on soy?
I still encounter that a little bit. And in fact, I think it's a shame because you see less soy milk in the grocery stores than you used to. You see less soy milk at cafes as a milk alternative than you used to. And I think it's because of that fear mongering, which is too bad because soy milk is absolutely healthy. Soy in general, it's a great source of protein if you're on the hunt for protein. It's got omega-3 fats. It's got lots of minerals and calcium. It's a good amount of fiber. So it's a very, very healthy food. In terms of the phytoestrogens in particular, I always have to ask my follow-up to someone who talks to me is that like, why soy in particular? There are many plants that have phytoestrogens. Animals have hormones, including estrogen. Plants also have hormones, including estrogen. Why is everyone so focused on soy? And yes, it does have more phytoestrogens than a lot of plants, but nobody's focusing on red kidney beans or flax seeds. Those also have a lot of phytoestrogens. So why? And my only rational idea that I can come up with and answer that question is that it's competitive for the dairy industry. So, or that in particular, but meat in general, is that soy is under a lot of scrutiny. And so they're grasping at straws of what might be wrong with it as, oh, phytoestrogens. Whereas nobody's worried about flax meal. Flax meal is not going to muscle out dairy milk at the grocery store counter. So there's no scrutiny there. But I also would say, okay, so yes, absolutely. Soy does have this phytoestrogen. What does that do to us? Like, let's not just be knee-jerk frightened of the word estrogen. Um, and what it does is it competitively inhibits our own estrogen. So we have estrogen receptors on our cells that our own estrogen circulating in our blood will bind to and cause changes in the cells that it binds to. Soy estrogen will also bind to the same receptors and block them from our estrogen. So it's competitive inhibition. It's gumming up the lock for the other one. Uh, and what that means is that we have a net reduction in our own estrogen signal. And instead, we're having this weaker plant estrogen signal. So it's almost like a net reduction in estrogen, even though we're consuming all this soy. And you can see studies, men who have the most soy intake have on average slightly higher testosterone than the men who don't. You can see reproductive cancers in particular, you know, prostate, testicular cancer, ovarian cancer, breast cancer are lower in people who eat the most soy compared to people who eat more soy. And that's because it's buffering our own estrogen. And the last thing I like to ask for people who are really worried about soy is, okay, so you're avoiding soy because it has estrogen, but you're having dairy milk. Dairy milk actually has far more estrogen than something like soy milk, and it's bovine estrogen. So what's going to have a bigger impact on our tissue, on our cells, and on our estrogen load? A plant estrogen, as we know, is weaker, or bovine estrogen? And the answer is pretty straightforward. The cow estrogen is much more potent, and that's why dairy products in particular see a increased risk in reproductive cancers the more you consume. Is that same exact equation I talked about with soy, but in reverse.
Okay, thank you. And one of our participants is asking about plantar fasciitis and wants to know if they can still do balance exercises with bare feet. Their doctor tells them that they should always be wearing shoes. What are your thoughts?
Well, one, I hate shoes, so I'm biased. I want you to have really strong, healthy feet. But if you're in chronic pain, like plantar fasciitis can get very bad. If it's a mild case where you're like, ooh, when I get up in the morning, my heels are sore, no big deal. Try and build it up and improve it. But if it's you've had it for years and it just kills you to walk on it and you cannot walk without shoes, that's going to take some work to get out of that situation. I will tell you, your doctor's advice of only ever wear shoes, only ever have arch support, only ever have ankle support is going to lock you into plantar fasciitis for the rest of your life. You're going to be trapped in those shoes because a quarter of our joints and a ton of muscles are in our feet, and those are all weak and atrophied. And they're going to get more and more weak and atrophied the more support and cushioning you give them. That's how that works. And so our body adapts based on what the stress we put it on. Balancing exercise barefoot, I would absolutely say that should be fine. The worst thing about plantar fasciitis is impact. So if you were to go out and run, or if you were to hop on the trampoline, like I mentioned, or do plyometrics, that would not be a good idea. That would be painful. But just standing barefoot, start with small loads, like maybe do 2 sets of 10 seconds per foot, leave it, wait 2 days, see what happens, and then build up from there. But I absolutely think you should be able to strengthen your feet. There's two typical causes of plantar fasciitis, and I don't want to take too much time from anyone else that has questions, but two typical causes. One is the plantar fascia is the fascia at the bottom of your foot, and it runs all the way up the back of your body, actually to the crown of your skull. So things along that chain of muscles can be overly tight, and they can be causing extra pressure in that plantar fascia. So make sure your hips and glutes are flexible. Make sure your hamstrings are flexible. Make sure your lower back and everything is flexible. Work on flexibility all the way up that chain of the back of your body, and that will take pressure off of your plantar fascia, and it sometimes heal from that. The other thing is make sure you're spreading your toes. And this is another reason I hate shoes is they scrunch your toes together. There is an artery that runs along your big toe that if you push your big toe up and in the way most shoes do and scrunch them together, you're pinching off blood flow to the arch of your foot. And so you might actually not have plantar fascia from being overly muscularly tight. You might have plantar fasciitis from having degeneration due to lack of blood flow to the arch of your foot. So being barefoot, allowing your toes to spread out, or even better, getting like toe spreaders and stretching your toes out will increase circulation to the arch of your foot and can aid in healing. So definitely work on being barefoot, get out of the shoes. And then if you can, build up how long you can balance on that foot. And hopefully we can get you out of being trapped in those shoes because we want you to have strong feet.
And what are your thoughts on yoga for fitness?
Yoga for fitness. I think yoga is fantastic. The things that concern me about yoga is getting into really aggressive stretch positions, like really trying to maximize your range of motion. That makes me nervous. I've seen enough people with tweaked lower back, tweaked hips, and pulled hamstrings, things like that. I think yoga really shines, actually, and this might be counterintuitive to a lot of people, is in mental health. Breath work, like meditative breath work, being present, being mindful, is really good for your lowering stress and just generally less chronic fatigue, things like that. And the combination of going through poses in a rhythm to slow controlled breathing is actually wonderful. If you get, I'm going to mispronounce it, but Shavasana at the end, the position where you're lying down, by
Right.
the time you get there, you're so relaxed and you're so sleepy. It's because you've gone completely parasympathetic. That movement combined with that slow controlled breathing has lowered your stress level through the floor. And so you feel really relaxed. And I think that is really, really, really healthy in terms of recovery, in terms of digestion, in terms of your immune system. So that part of yoga is my absolute favorite. And I want you to go and do that. Just be careful not to go really aggressive on the deep stretches. Those make me nervous.
Thank you very much. And we have about a minute left. So if you want to leave anyone with final thoughts on how they could begin their journey or do so safely, or anything you want to say.
Absolutely. We're learning more all the time about a lot of how these things are benefiting us. The clear picture that I'm seeing more and more and more is strength train. It's very important. It's going to improve every aspect of your body, even things you never even thought of, like brain health or like diabetes risk. Strength train. We're now learning more and more that power in particular is, your muscles' ability to contract quickly, contract with force. It may be even more important than just strength training in general. So strength train mindfully, focus on what you're doing, do less, but do it better. And everyone can start. There's no reason you can't do it. Even if you're in a wheelchair and you can only use your upper body, even if you're like in that one study above 85 years old, everyone will benefit. So do something, get started. It's just like a plant-based diet. Just try it, feel the results, give yourself 6 or 8 weeks for your body to adapt and see what happens, because there's no downside and there's tremendous upside.
Great. Derek, thank you so much for all the information you shared with us today. If we could unmute the audience so they could share their appreciation for Derek, please.
Happened, Vandenberg, who died in
Thank you,
1950,
Derek.
had
Thank
come up
you.
with
Thank you.
Everyone so much for listening. I hope you enjoyed this.
Thank
investigation.
you.